Good evening, you're watching The Big Story. I'm Haryanto Diman coming to you live from the Straits Times newsroom. Coming up on the show, we have senior transport correspondent Audrey Tan, who will share more on the safe distancing measures which will be implemented for public transport, as well as China correspondent Elizabeth Law, who is currently in Wuhan. But first, safe distancing measures will be rolled out across the public transport network in Singapore. All trains, train stations, buses, bus stops and interchanges will be progressively marked with safe distancing stickers. The number of passengers entering train stations and buses will be limited. Thermal scanners will also be deployed at selected MRT stations to provide an additional layer of screening. Transport ambassadors and bus captains, together with LTS officers, will help to enforce these measures. To discuss more on these measures implemented for public transport, we have senior transport correspondent Audrey Tan with us. Hi, Chris. Now, Chris,
Hi.
When the first round of social distancing measures was introduced some time back, many netizens had already asked if the measures also applied for commuting on public transport. Now, why are the safe distancing measures only implemented now?
Well, first of all, I think initially when we had all these measures coming on, it was not going to be possible or feasible for safe distancing to be implemented in public transport simply because buses and trains are very packed, especially during peak hours. 7.7 million trips are made a day, and the bulk of that is concentrated during the morning and then later in the evenings. If you were to implement safe distancing, it's going to be almost impossible, right? At its most crowded level, a train will accommodate up to 4 persons, 4 commuters per square meter. Now, if you were to apply our 1 meter distancing, safe distancing measure, you would have to probably increase your resource by 3 times at least, and all people will have to wait 3 times longer to get on a bus or a train.
Right. So, Chris, you're saying that, of course, the challenges to implement these measures for public transport, they are quite different and almost more difficult, as it were, comparing to implementing safe distancing measures, say, at food establishments or shopping malls?
That's right. For the reasons I just explained, the crowding during normal times, it just makes it practically impossible to implement these measures. But now, with more and more companies allowing their employees to work from home, and then with the latest measure that 100% of all learning institutions, schools, to have e-learning at home, volume on our trains and buses are a lot lower. The latest figure before the latest set of measures were rolled out tells us that it has fallen by 50%. That means half the volume. With the latest measures kicking in this week, we expect the crowd to be even smaller. And by virtue of that, we are able then to roll out the safe distancing measures that we talked about.
Right. Now, Chris, under the new law that bans gatherings at public or private spaces, offenders can be fined, jailed, or both. Now, would this new law also apply in this instance? If not, is there any penalty for commuters who fail to comply with the safe distancing measures on public transport?
The same legal framework applies here. So anyone who does not, keep a safe distance between each other on the trains or buses or at the stations and refuse to budge, even though an enforcement officer or transport ambassador tells them to, they can be taken to task.
Right, so the same law applies, for in this instance as well. Now, Chris, what more can be done by, say, the transport authority or even public transport operators to ensure commuters can travel safely?
I think a lot of it would have to, come back to the individual. The individual, in this instance, can do a lot for himself and as well as for others by simply wearing a mask when you go out.
Well, thank you so much, Chris, for your time. That was our senior transport correspondent, Audrey Tan, with the safe distancing measures that will be rolled out for the public transport network in Singapore. Now, yesterday, more than 3,000 advisories were issued to those who did not observe the elevated safe distancing measures, despite repeated warnings from the government to stay home. In a Facebook post earlier, Environment and Water Resources Minister Masagos Zulkifli announced that starting today, those caught gathering in public will have their particulars taken down. A stern written warning will also be issued to first-time offenders. Repeated offenders will be fined $300 or will be charged in court. Meanwhile, with all schools and most workplaces shut, many Singaporeans have visited parks to get their exercise in or respite amid the current situation. Authorities continue to enforce safe distancing measures at the parks. At Bukit Timah Nature Reserve, for example, multiple signs urging people to keep a 1-meter distance from those around them are placed throughout the trail leading up to the summit. MParks officers are seen making rounds to remind people not to gather and to keep a safe distance. Joining us to talk about safe distancing measures at parks is Science and Environment correspondent Audrey Tan. Hi, Audrey. Now, Audrey, you were at Bukit Timah Nature Reserve earlier today. How are MParks officers enforcing safe distancing measures besides giving verbal warnings?
Yeah, so once we got to Bukit Timah in the morning, we hiked up from the base of the hill to the summit, and along the trail on the way up, there were a lot of signs reminding people to keep at least 1 meter from the people around them. And on top of that, once we got to the top of the hill, we actually saw NParks officers deploying drones at the summit. So NParks later told us that that was used for crowd monitoring, and they'll be deploying about 30 drones at those parks that are bigger around Singapore, including East Coast Park, Bukit Timah Nature Reserve. And the data from the drones will be fed into a safe distancing map that NParks has developed, which will kind of give people an indication of how crowded a certain park or nature reserve is before people go down. So yeah, there seems to be a lot of safety measures in place. We also saw the pavilion that people used to gather at the top of the summit. It was fenced off, similar to this playground here behind me. I'm now at Pasir Ris Park. And the reason why all these areas are being cordoned off is so that, because the government is encouraging people not to loiter in certain places and to just go home immediately after they get their exercise.
Yeah. Now, Audrey, I just want to pick up on the point where you mentioned with regard to the website, right? People are advised to check the Safe Distancing at Parks website before heading over to avoid any overcrowding. In the event, say, the nearest park has high visitorship and the next nearest one is a drive away, are we still allowed to go to the further one?
Okay, so in NParks response, they did say that the purpose of the map is so that people can choose the park closest to them, which makes sense because people are encouraged not to leave their homes except for very essential things. So I guess that the point is, if you see the park nearest to you, if it's very full, you can always go back to the park for exercise when it is less crowded, and just try to minimize the amount of time you spend outdoors. So NParks also said that once you finish your exercise, which you are only supposed to do as an individual or with your immediate family unit, you should just go home immediately and you shouldn't loiter or hang around. In fact, this morning when we were at Bukit Timah Nature Reserve, we did saw NParks officers going to people who were resting to remind them not to linger and not to loiter and not to hang around, but to just immediately go home after they finish exercise.
Right. Now, Audrey, then is there a time limit as to how long one can spend at the parks?
I guess the time limit depends on how long your exercise routine is. NParks did say that you should just go home immediately after you finish your workout. So I don't think that they have mandated any specific time frames for how long you can spend outdoors. But yeah, the rule of thumb is just try to minimize the amount of time you spend outside your house.
Right. Now, Audrey, besides avoiding crowds and maintaining a safe distance from other park users, what else can one do to ensure their safety while getting their exercise in?
So just remember to stay 1 meter away from the people around you. Don't linger, I guess. Try your best to just go home after you finish your exercise. And I think these are just some of the safety precautions that I've mentioned earlier already. And yeah, that's what people should do.
Well, thank you so much, Audrey, for taking the time to speak with us. We've been speaking to Audrey Tan, our Science and Environment correspondent, who is actually at Pasir Ris Park on the safe distancing measures that is being enforced at parks amid the current circuit breaker measures to curb the spread of COVID-19. In the latest string of COVID-19 related charges, the two teenagers involved in a bottle drinking stunt at an NTUC FairPrice supermarket were charged earlier today for public nuisance with common intention. The duo had filmed themselves on February 8th swigging from juice bottles at a FairPrice branch in Bukit Batok before putting the bottles back on the shelf. They had posted a clip on Instagram with the caption, "How to spread Wuhan." Both teens were offered bail and will be back in court on 8th May. If convicted, they could be jailed up to 3 months, fined up to $2,000 or both. A 71-year-old man was arrested on Tuesday, the first day of the circuit breaker, for disorderly behavior after refusing to heed the advice of police officers and for shouting at them. He had wanted to eat at the void deck and had refused to cooperate with the police, who advised him to leave. Meanwhile, Singapore reported 142 new COVID-19 cases yesterday, the biggest single-day spike so far. This brings the total cases here to 1,623. While no new clusters were reported, the existing cluster at S11 dormitory at Punggol added 20 more cases. It is now the largest cluster here so far with 118 cases. Now, moving overseas, the number of coronavirus cases has surpassed 1.5 million less than a week after crossing the 1 million mark. Currently, the death toll is over 88,000. More than 320,000 patients have recovered so far. Italy may relax some restrictions put in place to contain the virus spread by the end of this month, provided the slowing trend of the pandemic continues. Italy's Prime Minister Giuseppe Conte, however, warned that the country cannot lower its guard and that the national lockdown imposed on 9th March could only be eased gradually. Meanwhile, France is set to extend its lockdown to curb the virus spread. The lockdown took effect on 17th March and has already been extended once before. It will now go beyond April 15th. Over in China, there was a slight increase in new COVID-19 cases for the second straight day, as the number of infections from overseas travellers hit a 2-week high. 63 new cases were reported yesterday, with 61 of them being travellers returning from overseas. We have China correspondent Elizabeth Law, who is currently in Wuhan, joining us via Skype. Now, hi Liz. Liz, we understand that you visited the Qin Yin Yan Hospital today, which was one of the focal points during the height of the outbreak. What do you find out there?
Hi, Yan. So today we visited the Qin Yin Tan Hospital in Wuhan. It is actually the top infectious diseases hospital here. So most of the most serious cases were actually brought there, and we actually had the head of the hospital to come and speak with us, and he says that now they still have a number of cases that are remaining, but what is of greatest concern to them really are patients who have spent something like 2 months, about 50 to 60 days in hospital, and are still testing positive for the virus. So he says that these are very concerning because after you spend that amount of time in isolation, firstly, they are mostly asymptomatic. Now, it's just that they still are testing positive for the virus. So as the patient, you feel very frustrated. And as medical practitioners, they basically are at their wits' end, that there are no more symptoms to treat, and yet people are still testing positive.
Right. Liz, I just want to move on now to talk about the temporary hospitals that were put up during the height of the pandemic. And I understand as well that you visited one today. What was it like inside this temporary hospital?
Right. So these hospitals, when after the height of the pandemic, when there was no more bed crunch in Wuhan, all these hospitals were actually shut down, and the reinforcement medical teams went back to whichever different province in China that they come from. But this last remaining one, as you can see on the video on the right, this is the Dongxihu hospital that was actually a field hospital that was converted from an exhibition center in Wuhan, and they've kept this up because they said that this is one of the ones that are that were really well done, and people are using this as an example. So as you can see, it takes quite a while to go in, because this is technically the exit route for medical staff, where when they exit, and they have to decontaminate themselves to make sure that they do not bring any contaminants out. The hospital looks basically pretty much like what we have in Singapore that are being built at Expo for the patients who have less symptoms. And similarly, this hospital was for patients with mild symptoms that were not so serious. They didn't need they weren't on high dependency, and they could still pretty much function on their own. So that was what it is. He says that people there generally spend about 3 to 4 weeks in this hospital. You can see they've just it's very basic. They've got beds, and everyone is it's about 20 to a room, and everyone has a small container and a little for your belongings and a little desk. So now it looks a bit sparse because they've taken out all the mattresses. They've thoroughly disinfected the place. He says they've disinfected the place 3 times. So I feel like I'm okay, but I came back and I took a shower after returning just to be on the safe side. We all have protective gear on. So that is what it is now. And he says that another reason why they've not taken it down is because even though the lockdown has lifted here in Wuhan, actually, at the end of the day, the epidemic is still not over. So they've kept it there.
Right. Now, Liz, you talked about, patients are still testing positive. Despite all that, of course, the numbers, they seem to be stabilizing in China. Does this mean that the worst is over? Will they be lifting the strict measures soon?
Right. So as I said, I mean, the Chinese government certainly does not think that it is completely over yet. There are still measures in place, such as having to take a temperature before entering a place, having to leave your contact details in case of contact tracing, and having to show a green code, which means it is this app on your phone that shows your health status based on where you've been and whether you've been in close contact with people who are confirmed cases. So these sort of measures are still in place. And for instance, like in Beijing, I can't just return to Beijing as and when I want. And especially since I've been to Wuhan, I have to apply for permission to re-enter Beijing. And as they have announced yesterday, we will have to take 2 nucleic acid tests. So we'll have to be swabbed, and we have to test negative twice before we are allowed back into Beijing. And of course, anyone entering Beijing has to be quarantined. So, and also Beijing aside, there is still a ban on foreigners entering this country, except in very exceptional reasons. So, are they going to lift these measures anytime soon? Given the situation around the world and the progress that China has made, they don't want to be seen to rest on their laurels, and also because there have been an increasing number of imported cases in Guangzhou province. So that is something that they're very concerned about, and I don't think that the measures will be lifting anytime soon.
Right. Well, it certainly remains to be seen what's going to happen there, yeah? Well, thank you so much, Liz. As always, thank you for speaking with us. Do stay safe. That was China correspondent Elizabeth Law in Wuhan, who shared with us more on the temporary hospitals that were put up during the height of the pandemic. Now, of course, on to the United States front, the World Health Organization chief gave a strident defense of its agency's handling of the coronavirus pandemic. Now, in response to US President Donald Trump's criticism and suggestion that Washington could review its funding for the agency.
We're close to every nation. We're colorblind. We're, what do you call it? Wells blind. We don't see. For us, rich and poor is the same. For us, weak and strong is the same. The United States and China should come together and fight this dangerous enemy. They should come together to fight it. And the rest of G20 should come together to fight it. And the rest of the world should come together to fight it. This virus is dangerous.
Joining me now to give us an update on the situation in the US is our US Bureau Chief, Nirmal Ghosh. Nirmal, earlier this week, US President Donald Trump tweeted light at the end of the tunnel. Yet the US seems a long way from flattening its curve. In fact, on Tuesday, the US saw over 1,800 COVID-19 deaths in a single day, the highest number to date. Where is Donald Trump seeing this light coming from?
Right, so this is President Trump trying to pick some small signs and project a sense of optimism to boost morale. In this case, the reference was to a slight flattening of the growth curve, the rate of spread of the virus in California's Bay Area and in New York, where even though they have had more deaths, the rate of hospitalization has slightly flattened. Throughout this, President Trump has tried to project optimism and in fact Yesterday, he defended this, saying as president, he has to project a sense of optimism. Now, as per the data, the virus travels in waves. We had the first outbreak in Washington state, then New York. New York may be peaking now, and now it is spreading in Louisiana. It is spreading in Texas. So as the situation improves in one place, it worsens in another. Certainly in overall terms, it is still getting worse.
The pandemic has also further set back US-China relations, yet China has just released Wuhan from lockdown, which if nothing else is a major victory in terms of morale and PR for China. If China gets back on its feet sooner rather than later, what does it mean for US industry?
Well, it would be good for the American economy because it would restart supply chains. It would restart one of the big economic engines of the world, and that would contribute to the revival of the global economy. I think business circles, including small business, which has been very badly hit, would be happy to see China recover because of all that, and also because it will show that one can recover. But of course, the strength and evenness of the recovery remains to be seen. As for the United States, we mustn't forget this is the United States. This is still very much the leader in terms of research, academia, entrepreneurship, creativity, and all the rest of it. The economy will recover. But at this point, a lot of uncertainty does remain, and not just for the United States. More broadly, what is at stake is global leadership. And there we may be at a watershed moment in which it is China that emerges in a global leadership role. We already have a lot of people in China saying this demonstrates the superiority of the Chinese model. But that is by no means a given. At best, it is still an open contest because these are two obviously very different systems. And while each has its strengths, they also each have their weaknesses. This contest will continue.
Nirmal, much like Singapore, one of the biggest questions in the US is how will an election take place during a time of pandemic and isolation measures. President Trump has been vocal against a postal vote, and we have seen many Democrat voters defy stay-home advisories to go out and vote in the Wisconsin primary. If the election goes ahead in November in the traditional style, who, if anyone, stands to benefit the most from here?
First, it looks likely the election will go ahead. At this point, there are too many uncertainties, however, as to who it will benefit. President Trump has spoken out against mail-in ballots, saying they are prone to cheating. The Supreme Court gave the go-ahead for a normal primary in Wisconsin, but it was not unanimous, and some saw it as tantamount to disenfranchisement because it gave you the option as a voter of voting in person and risking catching the virus or staying at home. And there is a theory, of course, that Republican states have been more skeptical of the virus threat in general, and Republicans may turn out in larger numbers. That would certainly benefit President Trump. And if he loses narrowly and there is a lot of mail-in voting, he could claim fraud in the mail-in voting. This is all speculative at the moment, but what is certain is we are heading into a very unusual and potentially fraught election.
Well, thank you so much, Nirmal, and as always, it's a pleasure to speak with you. That was US Bureau Chief Nirmal Ghosh, who spoke about the COVID-19 situation in the US and the US-China relations. Those are our top stories for today. For more news and videos, do log on to straitstimes.com. Also, do let us know what you're up to at home during the circuit breaker via Instagram stories with the hashtag StayHomeWithST. Once again, I'm Haryanto Diman. Have a good long weekend. Stay home, stay safe, and see you on Monday.
Of the mouth is always pretty dry, so you can spend a bit more time. 3, 4. You need 甘草. So after 10 minutes, remove this.
Today I'll be showing you some exercises which you can do to stay fit and healthy during this period. All you need